Good morning. I'm Axana Rodriguez Torres, a UC Davis graduate student in the program of Public Health. And I'm also a director for the pre-medical pre-health conference. I want to thank AAMC for the sponsorship in our event. And it is my honor today to present our next keynote speaker. She studied human biology and public administration at Stanford University and later obtained a Master's of Public Health degree at UCLA. She also there continued her education in medicine while developing a growing commitment to improving minority recruitment to medical school. She then went on to residencies in internal medicine at Santa Clara Valley Medical Center and White Memorial Center, and returned to the University of California for a fellowship in primary care health services research. From the very beginning of her training in medicine, she has worked to improve the recruitment and success rates of minority students in United States medical schools holding positions in UCLA School of Medicine Admissions Committee, California State Bar Examiners Committee, and has been appointed to a series of government-led research initiatives, including the White House National Healthcare Reform Task Force. She was named advisor for regional and minority women's health at the U.S. Department for Health and Human Services, served on the Advisory Committee for Health and Science Recruitment, which is part of the President's Commission on Educational Excellence for Hispanic Americans, and was also a delegate to the World Health Assembly in Geneva, Switzerland. In 1998, she became president of the National Hispanic Medical Association, which she also co-founded in 1994, and CEO of Hispanic Serving Health Professional School, Incorporated. She was named one of the 100 most influential Hispanics of the nation by Hispanic Business Magazine in 2001. It is my honor today to present a role model and mentor to many of us, Dr. Elena Rios.
Thank you, Oksana. It's a pleasure to be here. It's an honor to be here at the UC Davis conference. I flew in from Washington, D.C., and it's been a whirlwind in California. I come from the Whittier area, Los Angeles, so I got to see my parents, which is always a great pleasure. And I'm here all day today visiting with different friends and colleagues, including one of my most important mentors, Priscilla Gonzalez-Leyva, who's here, a former employee of the Sacramento's California State Department of Health, the Office of Statewide Health Planning and Development. So Priscilla, thanks for being here. What I was asked to do was to talk a little about my story. I want to tell the story in two phases. One kind of how I grew up and some personal messages, and school, because school is so important, right? Our academic careers, and again, some key lessons learned. But I really wanted to also talk about professional experience and how what I've done over the last 20 years or so, probably longer, but has really been based on the foundations that I learned as I went through my academic career. So although you're high school students, college students, you have a lot of future opportunities ahead of you, a lot of decisions to make, and I think what you have to learn, and I will focus on this at the end, is you have to find your passion. What is it that you like to do? And what is it that those around you like to do? So that you build and reinforce your passion. And that's my story, okay? So I started out really in a family of 5. I'm the oldest of 5 kids. My parents come from the Los Angeles area. My grandparents were undocumented Mexicans from northern Mexico who came during the Mexican Revolution to work on the railroads. My father's family came down from Colorado. My mom's family were in Los Angeles when my grandfather died, and they had to leave the housing that the railroads provided for the railroad workers. My father's family bought a house across the street from my mother's family. That's how they met. My dad and my mom got married in the 50s. I'm born a product of the post-Zoot Suit riots and post-discrimination of the Bracero program in California and the United States, where Mexicans were brought here to work in the farms and then told to go back to where you came from. Things haven't changed. We also had the first first issue dealing with discrimination in schools and school segregations that actually happened in California for Mexican-American kids and Filipino kids. And then we have Brown versus the Board of Education that became the big Supreme Court case, but we actually started it in California. The important thing about my family is that we were very close. All of our uncles and aunts and cousins and grandparents all got together every celebration you could think of, whether it was Christmas, Mother's Day, Father's Day, birthdays, and there were always birthdays. So it was very close, very supportive, and very, very supportive in terms of education. I think that's what I learned the most. In grammar school, I became the first in my class. I was in a Catholic school, a public school and then Catholic school. I won a math contest for the region of Los Angeles Catholic schools and got into a all-girls Catholic school, Sacred Heart of Mary High School in Montebello. And my parents could not have afforded it, so I was just grateful that I was able to learn that I loved math and I loved science. And I was also very interested in learning more about extracurricular activities like softball, like cheerleading, I wrote essays, I did spelling bees, I did drama, speech. This was all in 8th grade. In high school, I did the Junior Montebello Miss, the Miss Pico Rivera. I mean, it was just like one thing after another. These extracurricular activities allowed me to understand that I really did like to meet other people and do a little, but I just wasn't I was kind of shy and not really interested in being out there, but it was always my mother pushing me. You got to do more, you got to do what you can to excel and be all you can be. So when I finished high school, I got a college scholarship to Stanford University. And at Stanford, you go to school and everybody asks you, you're going to be a doctor or a lawyer? Or you're going to be a nurse? You're going to be a dentist? It's all about professions. And I think that I realized early on, before I got to Stanford, and I'll just jump back to this, my mother was studying to be a nurse. She was working as a secretary in the local community hospital, the Beverly Hospital in Montebello, and I got a job there working as a messenger, first a candy striper intern, candy striper volunteer, and then a messenger on Friday nights during my senior year in high school, and got to meet doctors and interns and nurses, and realized that it was just so important to see how great their passion was for health and for helping people that were sick. And it was just as basic as that. And I also understood how important it was that people from our poor backgrounds and middle-class backgrounds needed help and needed interest and trust and support from others to get into the systems of our hospitals. So when I went to Stanford, I was pre-med, and I was very, very interested in learning to meet others from other backgrounds. I met students from the African Americans to the Native Americans to the Asians to the Latinos from Texas and New York, Puerto Ricans from New York, Mexicans from Texas, and of course all of us were called Chicanos at the time. And I was very, very involved in what we called our MECHA organization, which was a student cultural group to support our efforts. At the time it was post-Vietnam, it was about financial aid, it was about students coming together and having their own funding for student groups like this one. And I think it was very important for me to realize that I love to see the consensus building and the meetings of MECHA and to find out that men ruled everything and that somehow women were going to take over. So we formed our own Chicana Colectiva, developed our own Chicana Conference. These were just women. But very interested in working with our brothers and sisters. But I realized the gender differences in leadership and how you had to stand up and figure out what you wanted and to be able to move forward in your life at that time as student leaders. I also became part of an executive committee for the Assistant to the President for Chicano Affairs. Cecilia Burciaga was another big mentor of mine, a very outstanding woman who came from Washington, D.C. Her husband was an artist he drew all the murals in Casa Zapata, where I lived as a freshman at Stanford, and he was an artist for the CIA. Cecilia was a member of the Civil Rights Commission of the United States, and she's the one who got me interested in thinking about working in Washington, D.C. And if I hadn't been around people like that who came from Washington, D.C., I would never even have dreamed of the opportunity or thought that I could, someone from California, leave California, because nobody leaves, right? Everybody's here. But someone could leave and find that they had even more passion by going somewhere else for a student internship. So I was a Washington, D.C. and government intern in 1976. In fact, my roommate, Maria Cheveste, is now nominated to be ambassador to Mexico. One of my other roommates and college classmates is a congressman, Congressman Javier Becerra, and others that I've stayed very much in contact with. In fact, one of my high school classmates is a speaker today at 5 o'clock, Bonnie Maldonado, probably one of the only Latina tenured professors in the medical schools in California. So we have a strong network, and that's what I learned at Stanford. I also learned that my passion was to think about organization theory and how do you get into the control situations within an organization so that you can help change things for the good of your community. In the 1970s in college, we all wanted to improve our own communities, and we were all going to go back, whatever that meant, going back to the Valley of Texas, going back to El Paso, going back to East LA, where I came from. But I had to recognize that I also wanted to go to Washington, D.C. to make a bigger impact, and that I was very interested in public health, not just going to medical school and seeing patients one-on-one, but having a population health approach where you could make changes to improve your health care. So I finished my degree in human biology and public administration, went on to public health school at UCLA, and learned about professionals like Dr. Robert Montoya, Priscilla Gonzalez, David Hayes Bautista, Gil Ojeda. And I met these professionals because they were ahead of me in faculty at UC Berkeley, UCLA, and they were part of the American Public Health Association. They created the first California Hispanic health plan for the state. And these were professional role models. And I, not that I became close to them, but I learned about them, and then I ended up working with them. I ended up also going to medical school after going to a post-bac program in Omaha, Nebraska. Never say never. You can always do what you want to do. I wanted to become a healthcare policy expert, and I knew a medical degree would be important. I think I just didn't go to medical school right away because I hadn't finished my organic chemistry or physics or one of those classes that I had to take. And I had to finish my post-bac in order to get better at science GPA. When you apply to medical school, you have to be able to be at the standard of your peers. And so anyway, I got into medical school, UCLA, and 1982, and what was happening with the medical students in California, the La Raza Medical Student Association had been started in 1977 by students at Stanford, and they had become residents. They were no longer medical students. When I got into medical school in California, 21 Latino medical students were in my class. All of us had been leaders in our CHEA programs or CCM programs, which were undergraduate Chicano pre-med clubs in the state of California at the time. There were 25 of them. And we all said, hey, we should go meet the La Rama students and tell them they should become more, more geared back to the medical student goals and mission that they were started with. So we did, and La Rama didn't like that, so we started our own organization. We call it the Chicano Latino Medical Student Association of California. There was a big transition that happened in 1983. We walked out of the La Rama group and formed our own. We included all the medical schools in California, just about, I think, maybe just one that didn't join at the time because they had a few Latino students. But we were very, very interested in developing what we could to have a support network and to recruit students and to have high school and college kids learn about medical school. And we kept a connection with other states. We ended up meeting Texas San Antonio's group, the Texas Mexican American Medical Student Association. We gave our bylaws to the medical students in Chicago and formed the Latino Medical Student Association of the Midwest. And we met the Puerto Rican students in New York who were called the Boricua Health Organization. And this was 1987 when I finished medical school. The presidents of schools got together, presidents of organizations, the AMA's medical student group, the AAMC's medical student group, the SNMA from the Black group, the family practice organization came together, and we got our Hispanic medical students to actually get invited, meet each other, and decided to form an organization that is now called the Latino Medical Student Association. We started the organization in 1987 with a newsletter. We started with phone calls, and by the time I became a resident in 1987 to 1990, I was in my residency, I was helping the medical students connect. Just a couple of phone calls here and there. But one thing I did do as a resident, and I went to residency at the Santa Clara Valley Medical Center in Santa Clara, which is a county hospital. I wasn't involved in all this organizing. It just happened that I was able to facilitate the organizing. So I got a phone call from Washington, D.C. asking if I knew Latino medical students. I said, yeah, I've been helping them connect. So I was asked to introduce them to a National Health Service Corps program in Washington in maybe 1991. And I did that by inviting the three presidents, the New York, Texas, and California. Chicago came afterwards. But we invited all of them together with advisors from your schools. And I have to tell you, another mentor, and again, I didn't work with her very much, but she was very much a mentor to lots of medical students here at Davis, and that was Margie Beltran. Margie Beltran went to our first meeting in Chicago with Jorge Girodi, who's now on our board of directors, and another woman from the University of New Jersey, and we got the AMSA bylaws and gave them to the medical students and said, we need to create a Latino medical student organization for this country, and let's have regions, and let's have representatives, and let's have, conferences in each region. And at some point, the national group would form an organization. And so that's how it got started. So as a resident, I was also interested in my own career and decisions about whether I should go into academics, or whether I should go into government, or whether I should go back to Washington, D.C. So I decided to do a research fellowship under the federal government called NRSA. It's a National Research Service Award, and it is an effort like the Robert Wood Johnson Foundation or the RAND Corporation, other leadership fellowships for health policy. And I did that fellowship for 2 years, from 1990 to 1992, and when I finished that fellowship, I felt like I could now go back to Washington or go back to Sacramento and figure out how my career would unfold. But as it turned out, the Latino medical students of California had actually become doctors. And the doctors decided, and this was again Bob Montoya and Gil Ojeda and everybody else, that they should start an organization for the state called CMAC. And again, they took the name of the medical students. The CMSA group became CMAC. CMSA still continued under the national network and LMSA, but CMAC became the first medical organization in California that has existed. The organization then had a president, Hector Flores from Los Angeles. I became the second president. And when I became the president, in this country, the first Latino Surgeon General was named, Dr. Antonia Novello, and she called together a conference of leaders from around the country, and since I was the president of the Latino Doctors of California, I was invited to attend. And Priscilla, I don't know if you were there, but I think Margie was there, and Hector went, and there was a few of us, Gil Ojeda. But what I noticed is there were very few doctors that were invited to this national conference for Hispanic health. And I thought, gee, that's crazy. How come doctors aren't invited? But I soon realized afterwards, a lot of the people invited are those who are connected to government because they're in academics and they're getting grants. You do research fellowships like I did, and you start asking for grants from the National Institutes of Health, or you're working in clinics, or you're working in hospitals and you're getting federal funding to keep your programs going for the poor, Medicare, Medicaid, these are all federal programs. Doctors are private business people. They don't ask for money from the government, even though doctors do get money from the government and reimbursement from Medicare and Medicaid. But anyway, that's the difference. The doctors weren't really connected to government agencies like I wanted to be. And I wanted to be able to change things to public health and population health, not just being a doctor in a private practice where you would see patients one-on-one. So that's what I learned as I went through my fellowship. And by the time 1992 happened and I finished my fellowship, I decided to go work for government and went to the state of California to work at the Office of Statewide Health Planning. And there, what I learned there was the importance of what primary care meant to our communities, the importance of having more doctors and nurses that work in our communities, in poor, underserved communities. You can go into academics and find the cure for cancer, but some people need to take care of our communities, and that's what I found at OSHPD. The culture of the workforce, the importance of the workforce, the importance of working together in teams and understanding how to do research about the workforce. So I also learned that I wanted to do more policy, and when I had the opportunity, I was invited by one of my college roommates, I mentioned her name already, Maria Chaveste. I was invited to go to Washington, D.C. to work in the White House on health care reform for President Clinton. To me, that was the most, I think about it, I said, how did I feel to be asked to help with a national campaign? And first of all, I was shocked. I had just finished school. But I also knew that I had been organizing and developing this network of students across the country. So I had this great opportunity to be able to find other Latino professionals and other African American professionals, Asian professionals, just like at Stanford, I had wanted to work with each other to lift our agendas and our voices up at the national level to help our communities. So I went to the White House. I was honored to be a special government employee, and I was asked to find people to come and provide input to what was going to become healthcare reform for our country, to have health insurance for everybody. That was the most important principle of healthcare reform, and that's what it is now that we have the Affordable Care Act. But anyway, so I brought a bunch of people to the White House. I was involved with the outreach groups. We had 40 meetings, 45 meetings, and brought people that were, they volunteered to pay their own way to come. This was before email, before conference calls, where people had to come together to have meetings. And every meeting that we had, whether it was for nurses or social workers or for students or for hospital executives, for medical school faculty, all the different groups we brought together, my goal was to find 5 Latinos from across the country to meet each other and to come into these meetings. The doctors that I invited were presidents of Hispanic medical societies from all over the country. Also students that I knew when I was at Stanford that were now chairman of family practice, or they were private doctors, they were in HMOs, they were in clinics, and I invited people that I knew from when I was in school. We had several doctors came, and at the very end of 1993, one of the meetings that I was at, because I kept going back to the White House for meetings, we decided that the AMA had come out against healthcare reform. President Clinton and Hillary Clinton said we need to have 10 different medical societies up on stage with us. They had a big C-SPAN event, and I was asked to represent Hispanic doctors. I said, well, we don't even have a name. So the few doctors that were there that day, and it was Jaime Cruz and Kathy Flores, and I mean, there was Luis Estevez from New York, Susana Morales from New York, maybe Bobby Reyna from Texas, it was Mark Diaz from here. We were all in Washington that day, and we decided on a name, the National Hispanic Medical Association. So we created our organization because we knew that we had the interest and a lot of people behind us who had done so much to get Hispanic health care done in California, in Texas, and New York, that we needed to have a national place and a national presence. So we created that at December '93. We got a lawyer, we got funding. One of the doctors that I met at the White House, Dr. Ciro Sumaya, became the head of an agency at HHS. He helped fund us, to give us funding to help develop regional meetings around the country in '95 and '96. We had a board of directors that came together, and we decided that we would start an organization with a goal to improve the health of Hispanics. Simple as that. We eventually changed that goal. Our mission now is to empower Hispanic physicians to work with our medical societies and our residents and our medical students and all our public and private partners to improve the health of Hispanic populations. We also very much become involved in leadership development and nominating those who we train to get into government grant review committees so they can help get grants to our communities, to nominate them to advisory committees to help build policies for prevention in this country, or for the NIH to build research programs. So we do a lot of nominations of our members. Those are some of the things that we do for our members. We also find speakers, and we do mentoring. And I have to say that's probably the most important thing that we have been able to do, is we have been given grants to find students like yourselves, high school and college students who want to go to medical school, but we bring you into our network and have mentors from the Latino Medical Student Association, medical students for the pre-meds, and we have mentors from our residents. We have a council of residents for the medical students, and then we have a council of young physicians to have mentors for the residents, so that we could have mentoring all the way up. That's how we're going to help you, and you help us build a network so that we can all learn how to go back to our communities, or to go to academics, or go into public health, whatever your passion is. And that's how I started this speech, is really about finding your passion, finding your mentors, and you can do whatever you want to do. The other things that we've done, and I just really wanted to focus just a couple of things on where we're at now. And I know I didn't mention, I also went from the White House to work inside the federal government. I would have stayed in the federal government if we didn't get the funding. I had to become the staff person to start the organization going. So the federal government office that I worked in was the Office on Women's Health, and I was able to learn two things there. One was how much the network in the government is, that you can't just work in one office. If you get into any big bureaucracy, you have to learn where you can make connections to work together. And I was in an office on women's health, but we worked with the Office of Minority Health, and I was able to plan the first conference on cultural competence, and to have medical education look at diversity and cultural competence, and how important that was. They asked us to come to look at the national boards that doctors take for their license on how to change questions to be more culturally competent. So when you're in a government job, you can actually make changes depending on the networks and the relationships that you can build. The other thing that I don't want to, let me just jump to the issue of NHMA. So the National Hispanic Medical Association was created to be able to find voices from our communities with our expertise that could give information to healthcare reform and to continue healthcare reform. So we're very, very honored that the Obama administration finally was able to have healthcare reform passed, the Affordable Care Act. And we have been building our organization around the Affordable Care Act by having regions now. So now we're not just a national organization with a national conference. We have 6 regions in the country, and we have medical students, residents, young physicians, our leadership fellows, which are the doctors that we have trained on leadership, who we nominate to advisory committees. We also look to work with the Hispanic nurses, the Hispanic dentists, podiatrists, the physician assistants, public health, the Latino Caucus of the American Public Health Association, Latinos who are in other healthcare professions, and we put them all together in our regional steering committees, and also at our national conference we give awards to the presidents every year so that they can meet each other. Because if we don't meet each other, and this goes for meeting well, let me tell you the future, but this goes for everybody, wherever you're at. If you're in a school, you're in student life, or you're in your career life, if you want to work with leaders and you want to work with other organizations, bring the leaders together to help, connect. So the future of NHMA, number one is STEM. We did a summit last year with the White House, with the National Science Foundation, with the National Institute of Health, with the Department of Education, with the Institute of Medicine, and others. We brought together about half Hispanic leaders from medical schools and African American leaders from medical schools, together with the historically black college and the Hispanic Serving Institution STEM programs, and all decided that the importance for the future of pre-med and pre-health students was to get more money from the government so that our schools could have bigger programs like this. And we're building legislation now so that the STEM money, the money that goes to science and technology and math training, guess what? The same students who get that STEM money are the pre-med student, or the pre-nursing student, or the pre-public health student. Those programs already exist, but they go to two-year colleges. Instead of giving money to the medical school, which is what has been done for the last 50 years, we're going to change the legislation to expand funding to the two-year colleges and to the state schools, and probably have a bigger pool of students to help lift up to medical school. So the money would go in grants to the Hispanic Serving Institution or the historically black college. And there's about 200 of these schools that are black, 200 schools that are Hispanic all over the country. And they would get the funding to be able to have mentoring and to support the students to go on to a four-year school and to go to medical school. That's what we see. And to have post-bac programs where you get a master's. So anyway, that's the future of what we're doing with NHMA. The other thing that we're doing is to have the importance of health equity and diversity within medical research. And we're working with the National Institute of Minority Health and Health Disparities right now to have a meeting in December, to bring together leaders again to figure out how do we find more researchers within our communities. Just like I realized how important it was to find young students who want to go back and work in their communities, we also need young students to think about going into research. And so we're interested in developing the research careers. And the third thing we're doing right now for next year that'll be announced is we are building a roundtable of stakeholders who believe in working together that are minority or who are interested in minority health and what we're calling health equity, so that we work together. And it's not just Hispanics over here or blacks over here or Asians over there, but that we actually work together. And so we've been asked to form I'm going to say a roundtable, not another organization. It's not going to be another organization. It's going to be a roundtable of leaders who are stakeholders and who are community-based organizations and who believe in the dream of health equity for our country. And that group is what NHMA is going to support with funding that we're getting from some of our partners. So let me the messages that I have really in summary is that you have to shape your own future with your dream, with your passion. We need you. I think academics are your #1 priority as a student, but you need to understand what your passion is. And when you do extracurricular activities, think about the long run and the future. And are you doing an extracurricular activity that's going to help shape your resume to get into medical school, or is it public health school, or is it policy? You need to have mentors, strong mentors that are there to not only ask questions and answer questions where you feel comfortable talking to somebody, but that you also get mentors who can open the door and tell you, you know, you need to go to Washington or you need to work here. You also need to have support, and I was always blessed with having very strong friends and support systems all the way through. You need to think about your relationships, and of course it's always hard, I think, for young students to understand where you're going to end up. I didn't get married, others get married. I mean, you're always trying to figure that out. It's always a balance. I think you have to learn from others and always ask questions, and always ask questions about yourself and are you happy? Do you want to stay on track of what you're doing? And I think you always have to do research for your future. You always have to ask others ahead of you, how was it? What did you learn from the situation? If you want to go to a medical school in the middle of the Midwest, hey, there's all kinds of great medical schools everywhere, but you have to ask people that are there to see if it's right for you. Think about faculty, think about the courses that you want to take, think about the recommendation letters that you want. Where do you go to get what's going to help you move to your future? And shaping your future, like I said, it really is about your passion and your dream, and leaders are needed every step of the way. And I can tell you that our leadership with the National Hispanic Medical Association is just starting. Next year will be our 19th annual conference. In about a year from now, in 2016, when we have our 20th annual conference, we're building it with the National Association of Hispanic Dentists and the Hispanic Nurses. We're looking forward to a huge conference, and again announcing that we have lots of activities for students, whether it's mentoring, we also have scholarships, but we are very much interested in working together to pull everybody up in this country so that we can have an America that really represents America. Thank you.